Hello everyone, welcome back. So we are starting with bowel nosodes and today we will do Dysentry-Co. So it is typically made from a preparation of Shigella bacteria, and Shigellas belong to the large family of Enterobacteriaceae. So by their physiological and morphological characteristics, they are related to Escherichia, Klebsiella, Proteus and Salmonella. At present, 10 serological types are known. The Shigellas are normally eliminated in the fecal matters of the person infected, but there may also be healthy carriers in whose stools this may not be detected. So now we will see constitution. So if you consider its constitution, subjects belong to the phosphoric types, the blondes having black eyelashes of pale color with red cheeks. Nervous type, tuberculinics with a restless mind, restless and apprehensive. So now coming to mind, there is anxiety from anticipation, fear without reason, fear of closed spaces, afraid of going out, of meeting unknown person. There is nervous stammering. Then there are tics of the face. That means involuntary repetitive spasms of the face. Then there is restlessness, embarrassed, depressed, incapable of struggle to impose himself. Now we will see the symptoms of eyes. So in eyes there is inflammation, irritation, conjunctivitis, inflammation of the borders of the eyelids, floating bodies and yellow vision, and also inflammation of the sebaceous annexi of the lips of an eye. Now we'll see the symptoms of ears. So there is discharge from the ears, sudden swelling of ears, bluish red color and then disquasmation. Now coming to nose, there is pain in the root of the nose. There is rhinorrhea, spasmodic and vasomotoric. Then there is acute catarrh of the nasal and ocular mucosa occurring in some subjects during the flowering of the Graminaceae. Graminaceae is a scientific name for the grass family. So now we'll see the symptoms of throat. There is frequent inflammation of tonsils, inflammation of pharynx, dryness of the throat. Now coming to lungs, there is thoracic pains by effort, sensation of constriction on the lower ribs, pleural pains, loss of breath, spasmodic cough with expectoration tinged with blood. Now coming to CVS, we have tachycardia, extrasystole, palpitation with precordial uneasiness. Coming to mouth, there is bad taste in the mouth, lips are dry and fissured, and tongue as if scorched and burning. Now coming to stomach, there is desire for fat, sweetened foods, salty foods and milk. There are postprandial pains of stomach which are better by eating, and pain in the stomach between midnight and 1 a.m. which is better by vomiting of large quantities of mucus. Now coming to the abdominal symptoms, we have distension of abdomen with uneasiness after meals, abdominal flatulence, pyloric spasms of babies. In rectum, we have diarrhea, frequent stools for 5 or 6 days. There is sensation of throbbing in the rectum and sensation of plug in the rectum. Coming to endocrine symptoms, we have hypertrophy of thyroid gland. Now coming to menses, we have dysmenorrhea, menstrual irregularity, throbbing sensation in the pelvis and perineum. In urine, we have urgent desire for urination in train, aeroplane, etc. Now coming to the skin symptoms, we have flat warts on hands, urticarial eruptions, dry dermatitis of the palms with fissures painful, then vesicles between fingers, facial cervical herpes. Then coming to locomotor system, we have pain in the knees, backache, articular pains of joints, inflammatory pains of the heels. Coming to nervous system, we have coriform movements of the muscles of the face or of the hands, supra or infraorbital neuralgia, trembling of muscles of the face. Then coming to sleep, there is irregular sleep, wakes up at 2 to 3 a.m. with uneasiness in the epigastric region. And then lastly we'll see modalities. There is aggravation in crowd, during journey, at night and towards 2 to 3 a.m. and amelioration from eating. Thank you.